Welcome back. We are here with Dr. Shane Creado, an Amen clinic psychiatrist. I'm so proud of him, sleep medicine specialist, and we're going to tackle sleep apnea. Now, why does a psychiatrist care? And why do I care about sleep apnea? Because we do brain SPECT imaging, and what I started seeing with SPECT scans is that people, they look like they had early Alzheimer's disease on their scan.
Interesting.
And what it really was untreated, undiagnosed, or diagnosed and untreated, very common sleep apnea, and it gives you an oxygen debt state that really murders brain cells.
I have a question. So when people are sleep deprived, Dr. Creado, do you see that can actually exacerbate or magnify underlying psychiatric issues dramatically?
Oh, definitely. Definitely. It goes to every single psychiatric disorder. It goes to PTSD, to anxiety disorders, to depression, to schizophrenia and cognitive impairments. And when we think about sleep deprivation and associated factors like sleep apnea, I chose to do sleep medicine training because really I felt our psychiatric training didn't really equip us to understand comorbid insomnia and sleep issues. And the reason I say comorbid is because in modern sleep medicine, we don't associate it as primary or secondary insomnia, for example. If the sleep issue is corrected, it improves the mood disorder and vice versa. They need to be tackled individually. So in people with PTSD, anxiety disorders, there's an increased risk of central sleep apnea, where their brain triggers the muscles to stop breathing because they're hyperventilating all the time.
So that's actually very important because we don't have much time and I want to talk about sleep apnea and restless leg. But children who have ADHD, who snore, that they actually may have sleep apnea that is the primary cause of their ADHD symptoms. And missing that, these are kids that do not respond well to stimulants. And you're really doing them a huge disservice. And correct me if I'm wrong, the idea I've had in my head, when I was young, there was a lot of tonsils and adenoids that were taken out. And they basically stopped that process. And when you have large tonsils or large adenoids, what happens is you can't breathe properly. You end up with sleep apnea. And now you have learning problems and you're on medicine for ADHD. So
you're so right. You're so right about that. I saw that in our practice with child and adolescent psychiatry. A lot of kids are put on stimulant medications because they have concentration problems. They're falling asleep. They're bouncing around, there are behavioral issues. Sleep apnea manifests very different in kids. They'll be irritable, they'll be cranky, they'll be causing trouble, they won't be able to do their homework. They're assumed to be problematic children. They put on medication for behavior issues. It's horrible. So we need to figure out if they're having sleep apnea and how to correct it. And you're right. Simple strategies. We do a sleep study in a lab, figure out if they stop breathing, treat the obstruction. If the kids have big tonsils or adenoids, those need to be out. And then you need to do a follow-up sleep study in a few weeks to figure out if the issue is resolved or not.
Yeah, that's so interesting. So we it's common sense that we think of if you have a psychiatric issue that it would affect your sleep, but we don't necessarily automatically think that sleep causes these other problems.
Isn't that interesting?
Yeah.
So what are the major symptoms of sleep apnea? When should someone suspect it?
Okay. Well, sleep apnea simply means a pause of breathing while you're asleep. The most common type is obstructive sleep apnea, where airway closes off and periodically during the course of the night, you stop breathing. So obviously symptoms might be snoring, which is primarily while you're breathing in. It's caused by vibration of the palate, the soft palate, and the uvula. You may have morning headaches because your brain has been deprived of oxygen, or dry mouth. You may have high blood pressure. You may feel sleepy during the day because you're sleep deprived. Drowsy driving is deadly. 6,400 fatal accidents in the US alone because of drowsy driving. Of course, if you have a thick neck, generally more than 16 inches, if you're a male, you have double the risk of developing obstructive sleep apnea, unless you're a female who's hit menopause, and then there's an equal incidence over there. So these are the important things we need to look for, and if someone meets those criteria, it's worth getting a sleep study done to make sure they don't have sleep apnea. There's a 20% concordance between sleep apnea and depression, which is huge. So we always ask people about thyroid problems and depression. How often do we ask a few questions? Like pauses in breathing. Of course, your partner will have to tell you that. Honey, I saw you stopped breathing for a few minutes last night. I was terrified. Some partners may be fine with that. In that case, be careful.
I actually helped you.
So there are some telltale signs there, and they need to be investigated further because sleep apnea can be deadly. So the way we think about sleep apnea is how bad is it? We talk about the number of times someone stopped breathing at night. And if you stop breathing 5 to 15 times per hour, it's considered mild. 15 to 30 times per hour, it's considered moderate. And if you stop breathing more than 30 times per hour during the course of the night, it's considered severe sleep apnea. But that's very, very simplistic, because what if you're stopping breathing 10 times per hour, so-called mild sleep apnea, but those pauses are several minutes each,
right,
or you're having severe dips in your oxygen? That's dangerous.
Yeah, that sounds crazy.
Now, I have had so many patients diagnosed with sleep apnea. They tried the CPAP for 3 nights.
They hate it.
They hate it, and they just ignore it. I did a YPO retreat where 8 YPO members, that's Young Presidents Organization members from Philadelphia, came to our California clinic. I scanned them all. And then as a group, I talked about each of their brains. And I remember this one guy, he was diagnosed 3 years ago. His brain looked awful. And he's like, well, I was going to get around to it, but I don't like it. And I just really got after him about, you're murdering brain cells every night that you're not taking care of this problem. So if someone is having trouble getting used to the treatment, what do you do?
Okay. There are many treatments. People always think, oh, no, I don't want to be tested because you're going to force me to wear a CPAP. But there's many more options. The first thing is weight loss. In fact, if someone loses more than 10% of their body weight, we should retest them to look and see whether their sleep apnea still needs to be treated with CPAP.
You stopped snoring after you lost weight. Now you rarely snore.
Thank you.
Yeah, no.
Now the whole whole world knows this.
Yeah, no, thank you. You're the one who tells everybody you lost 20 pounds, and it affected your sleeping, your snoring. Yeah.
Absolutely. And see, if you lose weight, you're not going to be having disrupted sleep. Your leptin is not going to be driven down. You're not going to be feeling hungry all the time. It's a positive feedback cycle over there. So weight loss is key. Then when we've done the sleep study, some people just have really bad sleep apnea on their back while they're in their supine position. Or when they've had alcohol at night, then they snore more. Or when they've had a muscle relaxing medication or Valium, benzodiazepines, then it's best to change the medication or even simply sleep on your side. That's an effective strategy for many people.
Oh, how interesting. That is so interesting. All right, we're going to have to stop because I have just, as I'm sitting here talking to you, I want to talk quickly about restless leg syndrome, but then I really want you to talk to our group about dreams and why we dream, what it means. I just think, as 2 psychiatrists talk, Freud said it was the royal road to the unconscious. Is that complete nonsense? What are your thoughts? Stay with us. Use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or on our supplements at brainmdhealth.com. Thank you for listening to the Brain Warriors Way podcast. Go to iTunes and leave a review, and you'll automatically be entered into a drawing to get a free signed copy of the Brain Warriors Way and the Brain Warriors Way cookbook we give away every month.